Hello, glad to have you join us on the news at 1 on the Unity Station, NTA Channel 5, Abuja. I am Mariam George Jitabo. The need for Nigerians to continue to avail themselves for the COVID-19 vaccination has been reiterated. These medical practitioners believe will reduce the spread of the virus. Aisha Uba Ali in this report examines the level of awareness among Nigerians and acceptability of the vaccine. The reports.
The year 2019 will not be forgotten in a hurry, with the outbreak of the novel virus which originated from China and ravaged the world, changing the way of life and so many things. Hand-washing practice, social distancing and wearing of face masks became the new normal that many needed to adapt to. It was not a time to relent for scientists and researchers who swung to action to produce effective vaccine in order to curtail the spread of the virus. And within a month, history was made as World Health bodies announced the availability of COVID-19 vaccine. The arrival of the first batch of vaccine to Nigeria was a pleasant news, even though there has been fear and misconception about the COVID-19 vaccine coupled with unverified information shared on social media.
It's not exactly the fear for the vaccine. I think it's the fear for the needle, because I can't really get over, the ideas that a syringe is getting into you, that's all.
According to Dr. Aisha Omaragbon, the advantage of taking COVID-19 vaccine far outweighs the disadvantages.
It gives what we call the herd immunity, because a lot of people are protected, so it prevents the infection from spreading further. But if people refuse to take the vaccine, then the epidemic continues.
Many public figures have continued to take the COVID-19 jab. Observers also believe it is a step in the right direction.
We have a responsibility to do the right thing. I think this is the way to go. So I'd like to encourage other Nigerians out there to please take advantage of this opportunity and get vaccinated.
All that I can say is that please, this is good for you and good for others and good for the health of all Nigerians.
What is the level of acceptability? Though some Nigerians are still skeptical, many have surmounted their fear. But for Moses Boniface, he says he will only take the vaccine when he starts to feel the symptoms.
Personally, I haven't taken it yet because I wouldn't say because I haven't seen the need, but because it hasn't been promulgated so much.
For those who had fears, what made them have a change of mind? Meanwhile, some have attested to have experienced side effects which varies in individuals. For Ibrahim Gang, his experience after the jab was more of psychological.
My reaction was just more of, I can't say it here because it was just fear factor in my brain.
Recommendation is that everyone should be an advocate and promote the campaign.
Meanwhile, figures from the Nigeria Center for Disease Control, NCDC, as at 11th April 2021, indicates 20 new cases of COVID-19 in the FCT, bringing the total number of confirmed cases to 19,723, while active cases stand at 479, and the number of discharged cases in the territory now stands at 19,080, and sadly, 164 deaths have been recorded in the FCT. Sustainable Development Goal 4 seeks quality education for all in a bid to reduce societal inequalities and number of out-of-school children. But how can this be achieved in a world heavily impacted by the coronavirus pandemic? Deborah Gazazi-Maika seeks to find out in this report.
Statistics by the Federal Ministry of Education indicates that the number of out-of-school children in Nigeria currently stands at 10.1 million.
The core of the Sustainable Development Goals is the concept or the idea of sustainable development. Sustainable development in itself comprises of three different domains: economy, society, and environment. It is the basic understanding of the interconnectedness of these three things that enables nations to understand that an investment in education is an investment in economy. An investment in the economy is an investment in an education of a nation. Now, it is pivotal that we encourage organizations, regardless of whether they work in economy or the society or the environment, to encourage educational development, because education in itself is the foundation of all developmental aspirations.
The alternate education is supposed to address the exclusiveness in education, because the reason why we have the out-of-school child basically is because the regular education system, as it is currently constituted, brings about a lot of exclusivity. It cuts out a lot of persons, a lot of school-age children from participating in school. And so if this alternate education, which Mr. President, I think it was in January 25th, launched and set up a committee to address, if this alternate education is on board, I'm very sure that if it is well implemented, it will address most, if not all, of the problems we as an organization have identified.
Some Nigerians believe these statistics would have been reduced, but the pandemic remains a constraint, hence the need to redouble efforts to regain lost grounds.
So many challenges now that are confronting the educational system. However, I will use this opportunity to now say that governments will now have to pay more attention to education for effective teaching and learning processes because of the circumstances or the present circumstances that we have now found ourselves.
The grassroots, which is particularly faced with the challenge of a conducive learning environment, as well lack adequate instructional and learning materials. Deborah Gazajin-Maika, NTA News.
And the menace associated with street children has been an issue of debate for decades. The International Day of Street Children, which is celebrated every 12th April, provides a platform for millions of children on the street around the world to speak out so that their rights will not be ignored. Chidima Salgomos report seeks to know if the children know their rights.
Position of children as the future leaders and the agents of national development in any respect is widely accepted by all and sundry. For this and many other roles expected of children, made it imperative for different countries of the world, including Nigeria, to codify in their constitution the legislations and various rights of children. But how many children know of their rights?
I know my rights. One of my rights, I must go to school, shelter, and obey the rules and regulations and parental care.
Country where people don't have much concern about children. You can see a lot of children, some are less privileged, use them as marginals in the country. Some are being trafficked here and there, using for housemaid and every other thing. So the country can do much by curtailing this, by creating a Children's Rights Act, in that people who endorse into such activities will be punishable.
There's already an act for the right of children. They need to intensify on it. I get it from time to time and actually monitor these things.
For a country to move forward, it needs to ensure that Nigerian children are always viewed as the leaders of tomorrow who carry the future and the destiny of the country on their shoulders. It is hope that the voice of street children will be given more attention, equality and access to essential services. Chidiman Sin Agomo, NTA News.
Now, drunk driving is the act of driving under the influence of alcohol or hard drugs. In this report, Odiri Ogboru Arutere takes a look at the implication of driving while drunk.
Research shows that 90% of road accidents in Nigeria are caused by human factors like fatigue, overspeeding, drunkenness, among others. Experts say this factor contributes the 90% of road crashes that have consumed lives and rendered millions physically challenged. Motorists are therefore advised to resist the temptation of drinking and other drugs before embarking on a journey.
It involves a lot of risks. The person that is driving is risking his own life as well as the life of other road users.
My advice is if they can catch someone driving when he was drunk, it's better for them to collect his driving license and keep him somewhere when his brain calm down, so that they should advise him.
It's not good because when you're drunk, you are driving, so anything can happen. Even road safety must they are aware, says anybody will drink where they catch him.
FCT Sector Commander FROSC Ayuba Wobin Gora frowned at the act of drinking and driving and called on motorists to shun the act or face the consequences.
We make sure if we want to establish it, we subject him to a breathalyzer test. Okay. That's what we subject him to. And when he blows that breathalyzer, if the blood sample, if what is in his blood sample is more than 0.05, then it means that person is drunk. But if it is within the range 0.01 to 0.05, then we may not consider that person as a drunk person. When we issue a ticket, it's 5,000 naira. That is the fine for now.
Experts warned against drunk driving. They say, if you must drink, don't drive. If you must drive, don't drink. In Abuja, Odiri Ogboru, Arutere, NTA News.
Many thanks, Odiri. Chairman Abuja Municipal Area Council, Abdullahi Adam Candido, has inaugurated the Palace of Sakarui and a block of 3 classrooms with the headmaster's office at the LEA Primary School, Gwarimpa. This is in a bid to ensure that the council's dividends of democracy get to the people at the grassroots. Howard Gimba was there and now reports.
God will continue to bless Karu children and Karu people. Amen.
That was the official inauguration of the Sakaroi's Palace in Karu by the chairman, Abuja Municipal Area Council, Abdullahi Adamu Candido.
2 palaces have been completed, that is Joa and the Karo, whereas that of Karishi is ongoing. So our idea is to complement the effort of our sister government, that is the FCTA, in complementing their effort and in our own desire to also ensure that the royalties in Amak get the best of comfort as they pilot the affairs of their traditional communities.
The district head of Karu, Atanutu Shaimbawa, while appreciating the giant stride by the Abuja Municipal Area Council, expressed gratitude.
Please, whosoever that is coming again, please, we still need more. We still need more. We are just like Oliver Twist, that is still asking for more. Thank you very much. God in his infinite mercy will keep you.
The chairman further proceeded to the LEA Primary School, Gwarimpa, where he inaugurated a block of 3 classrooms with headmaster's office. These, he says, will help them concentrate more on their studies as well as checkmate what they do in class. He urged the teachers to project issues that will help the educational sector of Amak. The chairman, Abdullah Adamu Candido, promised the council's readiness to deliver more dividends of democracy to the people. Hawagimba, NTA News.
You're watching the news at 1 on NTA Channel 5, Abuja. We'll be back after this message. Please stay with us.
Please cover your mouth with your bent elbow like this.
Auntie, cover my mouth for what? Corona don't go from Nigeria. I beg, Auntie, go to stop my life.
No. Coronavirus pandemic is not over. Don't relent in observing safety protocols and good hygiene. Frequent hand washing with soap and water for at least 20 seconds or use an alcohol-based hand sanitizer. Practice good respiratory etiquette, including covering your coughs and sneezes. Avoid close contact with a sick person. Cover your mouth and nose with a mask when around others. Clean and disinfect frequently touched surfaces.
You're absolutely right. Coronavirus is still with us.
Please, and remember, coronavirus pandemic is not over. Protect yourself and others to stay safe.
This message is brought to you by NTA Channel 5, Abuja, the Unity Station.
Glad to have you back. Report just reaching us says the National Association of Resident Doctors have resumed work after 10 days industrial action. Aisha Uba Ali is standing by to give us an update.
Thank you, studio. We are here at the National Hospital to look at the activities after the call-off of strike by resident doctors. If you may recall, on the 28th of March, the doctors agreed to go on strike, which commenced on 1st of April, and 10 days after, the doctors, after so much deliberation with the federal government and interfaith, decided to call off the strike. So we're here to look at activities happening at the, before we came to the clinical services. We are at the area of the clinical services of the National Hospital and Pediatrics. But before we came here, we were at the accident and emergency unit, where the nurse told us that they are able to admit patients this morning, unlike during the strike, where they could not admit any patient. But to shed more light on the resumption, let's talk to the spokesperson of the hospital, on who is Mr. Dr. Tayo Hastrop.
Where we are now is the clinical areas, where we have the major clinical areas in the hospital, and it's full of activities. Patients are all over the places. We have adjacent to the places the pharmacy unit, where they come for their drugs, prescribed drugs, and also the cash point. Everybody, the activities have come back to National Hospital. We have started admitting patients this morning, you know, because all the doctors are on ground. The senior one who did not join the strike, who are consultants, they are not part of resident doctors. They have been working, but it's just that the full complement of work has not been there, because they need the resident doctors to be able to complement full work in the hospital. And we can see all over the places, the lab area, the pharmacy area, the clinical areas. It has come back to life again.
I came here since in the morning, and activities has been going on well. So is a good one. It's a good one, because if the doctors could have still been on strike by now, at least so many lives could have been in danger by now.
From what we've heard from the patients, it's a thing of joy that the strike has been called off. From the National Hospital here in Abuja, Aisha Uba Ali, NTA News.
Thank you, Aisha, for that update. Now, according to the disaster managers in the FCT, one of the major challenges leading to loss of lives could be attributed to lack of adherence to caution by residents. In this special report, correspondent Ilyasu Onotu Yakubu takes a look at the impact of the negative attitude of residents in flood-prone areas.
Residents such as this victim in this amateur video and a host of others have been constantly adamant in their refusal to adhere to warnings and caution from disaster managers on the dangers of flood. And this challenge has resulted in the increasing spate of loss of lives annually to flooding.
Our word to people, once you see any flood, any moving water, any running water on the road, don't assume that I'm used to this road. And then you say, it's about 10 meters, let me cross. You wouldn't know what will happen.
Experts say if the postulations expected from hydrological services are anything to go by this season, the territory may need to re-evaluate risk assessment of prone areas with strategies and policies to curtail the impact of flooding.
We are pleading with the residents of FCT. Don't undermine, don't underrate the power of water. Once that a pool of water is gathered together, especially when it is moving, when it is flowing, please don't insist on going through that road.
In what the Director General of the FCT Emergency Management Agency, FEMA, described as enlightened people who feign ignorance of the dangers of the life-threatening strength of running flood water whenever they are in the territory, he called on residents to always abide by the sensitization to save lives.
Like I said, apart from the 5 people that died at Igiri, 2 people were enlightened people who could stop and wait for the water to pass before they can cross. But they ignorantly or deliberately passed through the water and they could not be able to get to the end of it. So I call on the resident, follow the instructions. It doesn't take more than 15 minutes, the water will go.
Disaster managers say while stakeholders continue to strategize for focused response and mitigation, residents need to heed to caution so that proactive measures may yield desired results. Ilyasu Onotu Yakubu, NTA News.
And to religious matters, the holy month of Ramadan is fast approaching, and Muslim women have been charged to strive harder towards perfecting their belief by eliminating bad habits and concentrate on acts of charity, more especially this period. This was the speaker's consensus at the 2021 Pre-Ramadan Women Lecture put together by Abuja Islamic STEM School in Abuja. Hawa Gimba has the details.
It is important for every Muslim, male and female, to increase his or her spiritual efforts and reap the maximum benefits from the holy month of Ramadan. Speakers who elaborated on zakat, menstruation, stress and anxiety say these are certain aspects of the holy month that is pertinent to women especially. Hence, the need to do more of zakat and recite the Holy Quran in the holy month of Ramadan cannot be overemphasized.
Any person that has this amount that Allah subhanahu wa ta'ala gives it to him, he should know that Allah gives him this money not for himself alone. It is for himself and his community.
Indeed, my Lord is with me and he will guide me. That is tawakkul. You don't know how to navigate through your life. You don't know what is going to happen, but you are certainly reliable upon Allah subhanahu wa ta'ala.
Participants at the 2021 Pre-Ramadan Women Lecture from Al-Tabia Islamic STEM School say they have learned a lot from the lecture, especially the spiritual obligations during the holy month of Ramadan.
This topic of anxiety, stress, and then letting go, knowing that you are not in control of anything, that Allah is in control.
Zakat. So we learned a lot about zakat, how to give zakat, the amount to give and everything, zakat of gold and the silver.
The 2021 Pre-Ramadan Women Lecture had women from different ages in attendance. Hawagimba, NTA News.
And Islamically, among the numerous virtues of Ramadan was the revelation of the Holy Quran, which is meant to be recited and reflected on. Guest speaker at the Muhammad Lawal Memorial Jumaat Mosque, Asokoro, Sheikh Mustafa Agbaniri, stressed the importance of preparedness for the holy month of Ramadan. Aisha Bashir has the details.
Raising the level of awareness over the fast approaching holy month of Ramadan is a common practice among the Muslim Ummah. Sheikh Mustafa Agbaniri speaks.
Many people don't know what Ramadan is all about. People just think Ramadan is just to fast. You cannot do Ramadan very well if you don't know what Ramadan is itself. For us to be Ramadan compliant, we have to understand Ramadan. I told the gathering.
The 2021 Pre-Ramadan lecture at Muhammad Lawal Memorial Mosque Asokoro had dignitaries from far and near in remembrance of the late Muhammad Lawal. They urged Muslims to learn from his humanitarian gesture when he was alive, as well as use this holy month to pray for forgiveness.
The Imams who are very knowledgeable in Islam are here to sensitize all of us, to educate us so that we will take maximum advantage of 30 days or 29 days of Ramadan to do exactly what is especially for us.
One of the pillars of Islam, it's a holy month. It's a month of piety, of sacrifice, of good behavior, of spiritual awakening.
This mosque was started by my husband, my late husband, late Alhaji Muhammad Alabi Lawal. A beautiful way to tell us that there are certain things that we have forgotten in the whole year, and this new month has come again. We must remember how to behave and practice Islam better.
Scholars at the 2021 Muhammad Lawal Memorial Lecture shed more light on forgiveness, prayers and repentance. Hence, Muslims should imbibe such qualities during the holy month of Ramadan and after. Aisha Bashir, NTA News.
Team Bielsa loses 6 medals, 4 gold and 2 silver, as the main organizing committee of the Edo 2020 disqualifies swimmer Dino Ebaru Komo following petition against him. Details of this will come your way in a subsequent bulletin. And before we go, a quick reminder. COVID-19 vaccine is free. Please avail yourself the opportunity to be vaccinated. It is the effective way of curtailing the spread of the virus. And that concludes the 1 p.m. news. Thank you for joining us. Join us at 7 for more news. Have a good afternoon.